dosing's important and timing's important. Some, people say, I work all day, I can't be intoxicated, or I need to drive, or I work, I'm doing heavy machinery. Can you talk about, in your practice, what you recommend for best timing, as well as the dosing? Again, we talked about, less is more in many cases. And can you talk about that?
Sure. So timing, as you point out, is a huge issue for exactly the reasons that you mentioned, right? I mean, most folks are busy doing what they need to do during the day, and can't afford to be intoxicated or even just kind of mildly fuzzy headed. The thing that I find most interesting about cannabis when it comes to anxiety and depression is that I think most of us think that the benefit comes from the intoxication. And in some instances that may be true, but not specifically about depression and anxiety. And so if we can give that little dose that we've been talking about sort of around bedtime, then not only can we improve sleep, which is sort of, as we said at the beginning of this, kind of part of that ball of wax, but what happens is whatever the chemistry is doing to sort of reset our brain, it's not directly tied to that intoxication. So the intoxication wears off overnight and you wake up feeling rested and clear-headed, but the antidepressant, anti-anxiety benefit persists throughout the next day. And that is an ideal situation because then we don't have to use a dose in the morning and then start to intrude upon all of those activities of life that we need to be sharp for. So using this stuff around bedtime turns out to be really ideal.
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at Patients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.